personal podcast. This podcast is designed for that person who knows there's a better way towards health and wellness. They just don't know what that better way is. And we've been reviewing my book, Stealth Health, which was published in early 2020. I completed it prior to the world falling apart. And like I've said, it's amazing to me how a lot of what I read in this book has been amplified over the last few years. We are in the middle of chapter 1, and I start a section called Chiropractic Malpractice Cost. What I attempted to do in chapter 1 was to shake the legs of belief of what we have always considered to be the normal right pursuit of quote health is really not a firm foundation. So I'm shaking the legs of belief of my reader to then reinstall some new concepts, a new way of seeing things, a new perspective. So chiropractic malpractice cost. I start off with a story, and then I go into this question in the second paragraph. So, is chiropractic safe? And what I find fascinating over the years, and I've been in practice for over 30 years now, is that when I have a patient may come in and they'll say, "Oh, my doctor said not to touch my neck." Or I might see somebody out in the world and say, have you tried chiropractic for your problem? And they'll say, "Oh, my medical doctor said don't go to chiropractor, they're dangerous." And I didn't talk about it in Stealth Health, but there has been a concentrated effort to eliminate chiropractic um, since the 1960s, a concerted effort created by the American Medical Association, and it ended in a lawsuit in the mid 1980s. So it took 20 years for this lawsuit to finally get judged upon. And the American Medical Association was found to be guilty of restricting commerce and trade of another profession. I think what I'll do is I'm going to save that for a separate episode of Stealth Health so I can forge ahead into chapter 1. So, is chiropractic safe? And in Stealth Health, I go into detail about malpractice insurance. Now, you know, insurance is based upon how much risk is involved, and this is purely a numbers game. It's the actuaries of insurance companies, the real number crunchers, that determine how much insurance will cost for you and for me, and for your home, and for your life insurance, and for malpractice insurance. So I'm going to read to you. Um, so medical malpractice prices are set based on the risk of each profession. In the medical profession, obstetricians pay between $85,000 and $200,000 per year just for insurance coverage. They pay that every year. Neurosurgeons pay between $50,000 and $150,000 per year, while the expenses for your general internal medicine doctor is about $35,000. Now, of course, this is referenced, and I have the reference on the same page. And chiropractors pay $1,500. That's what I pay approximately per year for my malpractice. So it is not $100,000 per year. It's not even $50,000 per year. It's not even $10,000 per year. It is $1,500 per year. That alone should illustrate to you the safety of the chiropractic adjustment and the chiropractor in everyday practice. Your general practitioner pays 23 times more money per year for his or her malpractice insurance. The obstetrician pays over 100 times per year. This is an overt testament to the safety of chiropractic care. So when your medical doctor says something to you like, oh, they'll paralyze you, oh, they'll kill you, oh, they're not real doctors, oh, this, oh, that, oh, never do that, oh, never see a chiropractor, you can say to them, well, that's interesting. You say that it's not safe, but yet I know this for a fact. Chiropractors only spend $1,500 per year on malpractice insurance. Then I go on again to shake more legs. I go on to talk about cholesterol and cholesterol medication. The title of this part is Lowering Cholesterol is a Big Business. While you may not be aware of the above lies, meaning that about malpractice insurance, about the safety of nutritional supplements, about the dangers of medications, the system tells us one lie that has become accepted by most Americans as truth, that lowering your cholesterol is imperative for your health. Cholesterol, in all of its forms, is an important part of every cell in our body. There is something called a cell membrane, and it is the package that every cell in our body sits in. There's 40 quadrillion cells in our body. Every one of them is a package called a cell membrane. And the cell membrane is made from fats. Fats protect our body, and within that cell membrane is proteins that allow stuff into the cell, kind of like a sliding door, and allow stuff out of the cell, like toxins and waste products, allows nutrients in and allows waste products out. And then the rest of the cell membrane, the whole cell membrane, is all fats. Cholesterol is a major part of that. Cholesterol is also the building block of hormones, the tiny messengers of our body that make all of our basic biologic functions work. Our sleep, our energy level, our moods, our sexual vitality and attraction, all the basics of life are controlled by hormones. Cholesterol also coats the nerves, and that's called myelin. If the myelin sheath, it's called, starts to wear away, the electrical firing of our nerves becomes faulty. This could and does create physical disability, decreases in sensation, and impaired cognitive ability. And this is called multiple sclerosis. When the sheath, the protective fatty sheath or covering of our nerves starts to wear away or disappear. The war on cholesterol started in the late 1940s and early 1950s, and this is when the World War II veterans were coming back home to the US. And I don't go into it here in Stealth Health, but there was a faulty study that was completed on American GIs, a faulty premise for a study, a faulty step-by-step process, which made incorrect conclusions be drawn. And you can go back to that one study now and see that's when things started to go off the rails as far as what is considered normal cholesterol and are fats in our diet healthy or detrimental. Fast forward to today when over 35 million Americans take statin drugs. Statin drugs are a class of drugs that draw cholesterol out of our body. Now, the normal for cholesterol previous to the year 1998 was 240. That was the blood level that was normal. In 1998, that level was dropped from 240 to 200. So if you had a normal blood lipid level in 1997 of 239, all of a sudden in 1998, you have high cholesterol because they changed the number for normal. When I talk to my patients today and they say, oh, my doc put me on a statin drug, I say to them, what was your number on your blood test? And sometimes they have to go back to the blood test and bring it in for me to see. And I am not a medical doctor, and I don't prescribe, and I don't recommend you not to take your prescribed medications. But I will tell you this, that back in the early 90s, a level of anywhere up to 239 on your blood test was considered normal. So reports are mixed as to whether artificially lowering cholesterol reduces the chances of death of a heart attack or not. What if lowering cholesterol artificially was a bad thing? Just ponder that. Imagine that by reducing the needed cholesterol in your body, your basic human functions were diminished, like your energy level, your reproductive capability, your, let's see, your insulin level, which is your ability to process sugars, your cognitive ability. I continue. Your drive to achieve, your happiness, your ability to sleep are dependent on your body's ability to make hormones. Testosterone in both male and females, serotonin and dopamine, melatonin, and all the rest. If those basic functions, the love of life, the feelings of liberty, and the pursuit of happiness, were curtailed, what might you demand? Honestly, probably nothing, because you're just too tired to argue. Think about this one. If the fatty myelin sheath surrounding your gray matter of your brain, the thinking part of your brain, was reduced and your intellect was diminished, how much fight would you have for bucking the system? Not a lot is my thought. I could be going out on a limb here, but is the system purposefully depleting us of our normal human urges in order to keep us contained, blindly following nonsensical directives? Are you becoming angry yet? I wrote this prior to 2020. What if the system was purposefully depleting us of our normal human urges in order to keep us contained, blindly following nonsensical directives? I'll go on. The new reality. In Elizabeth Rosenthal's book, American Sickness: How Healthcare Became Big Business and How You Can Take It Back, she describes a perspective of medicine that is based on treatment and testing with little concern for real patient outcomes. I believe, me personally, Dr. Nancy Trimboli, I believe that the system does not heal people, it creates patients. This is why when people ask me about this food or that food, which is better, this one or that, and I ask them to look on the ingredients of the container, the more ingredients there are in there, the more removed it is from the actual living food, the worse it is for you. I believe that real food, true food, is going to nourish our body best. And so how that relates to this is that the food companies and chemical companies are also part of the system. The further they can get you away from real food with addictive ingredients, with excess sugar, the sicker and sicker and sicker you will be, and you just get fed right back into that system again. So, continuing about Elizabeth Rosenthal's excellent book, documenting patient encounters with medical professionals has greater importance than the encounter itself. And I know this as a practitioner because when I was first in practice and we had our yearly continuing education, which I needed to do within my state, It was often how to read x-rays better, how to read MRIs more accurately, how to see a crisis with a patient that was in your office so that you can refer out for crisis care, meaning to the emergency room in a timely manner. It was things like that. It was all about patient care. Now, the last nearly 10 years, it is how to write your notes properly. How to write the notes properly. That's what our continuing education in what's called risk management is all about. Isn't that infuriating? How to write the notes so you'll get paid from an insurance company. How to write the notes baffles me. So that's why I wrote documenting patient encounters is more important than the encounter itself. The family doctor that you grew up with, or maybe even made house calls. I remember when I was about 6 years old and I was ill, my family doctor came to my house, I remember, as a little girl. So that no longer is the reality. Treatment options can be more frightening than the disease or condition itself. You, as the patient, have little or no control over the costs of your doctor's visits, medications, testing, or procedures. The referral maze of sending you from one doctor to another. You go to your family doctor, they send you to the orthopedist. The orthopedist sends you for a blood test. That blood test means you go to the rheumatologist. The rheumatologist says, no, not for me. I want you to go to this orthopedist. And meanwhile, you have still the same problem. The referral maze of sending you from one doctor to another, all without any semblance of the concept to restore your health, leaves you with less money in your pocket and less time to do the things you enjoy. So not only do you not feel good, you're missing out on the joys of life. Your calendar is filled with appointment. It's so sad when I see some people that they can't even go on vacation anymore because they have a doctor appointment that they waited 2 months to have. And I know in my heart it's going to be another dead end, but yet they stall their life to keep that appointment. All of your, and this is me continuing, all of your worst inner thoughts about conventional medicine and how it has changed in the last few years are founded. It is not your imagination. So, your first step on your journey to unravel your health mystery is to recognize that this is the new reality. No longer is medicine a healing art. The conventional medical model has been degraded to an algorithm. Now, an algorithm, I'm going to bring up this page from my book, Stealth Health. And it's an algorithm is how one step leads to another, and at each step along the way, you're answering a yes or a no question, and it leads you to different pathways. So I'm going to share screen. So you are seeing my book or the page from my book. This is page 31 from the softcover copy of Stealth Health. And this is a algorithm. Now I'm going to start reading from Stealth Health and then show you what I'm looking at here all along the way. Start at the top box. Notice the Latin terms designed to put a crowbar in your brain and make you stop all searches for answers. I call this being labeled. When you get labeled with a diagnosis, it it gives you a name for something, but it does not stop your journey for wellness. It does not start you from unraveling. Well, maybe it does start you from unraveling your mystery because I'm going to teach you how to do that. But it's a label that now you get to say to people, "Oh, I can't do that today. I've got my this, whatever your label is." So chronic rhinosinusitis is a diagnosis for which you have been labeled. For now, let's not worry about this other piece, with or without polyposis. To untangle the meaning of a diagnosis, start shaving parts off the phrase and decipher each. Chronic, by definition, means the symptom has lasted a long time. So that's this word chronic. That means it's been lasting 3 months or more. You can figure that out by doing an internet search for its definition. Rhino, if you were to search word origin, means nose. Rhino means nose. And we all pretty much understand sinus as related to our nose. So rhino sinus. So the sinus in our nose, because there are other sinuses in our body. Um, but you'll discover that sinus refers to any cavity in our body or space. And the last portion of the diagnosis is itis. Now, the itis part of Latin diagnoses gets thrown around a lot. Listen to these: bursitis, tendinitis, plantar fasciitis, cystitis, and there's many more. If you look up that word, it means inflammation. So I know inflammation is a hot topic in the news these days, but what does it really mean? It will tell you, if you do a quick definition search, it will tell you it is a localized condition in which a part of the body becomes swollen, reddened, painful, possibly hot, especially as a reaction to injury or infection. So basically, this diagnosis, chronic rhinosinusitis, is saying that your nose is stuffy because it's inflamed, meaning swollen and painful, and it's been there for a long time. It may be due to an injury, which is not likely, it's possible, but not likely, or an infection. But let me ask you a side question. Why is there an infection present? So, really, honestly, labeling yourself with chronic rhinosinusitis tells you nothing more than what you already knew. I've had for a long time a stuffy nose and it feels inflamed. So, no matter how silly that sounds, once a diagnosis has been established, this algorithm we're looking at directs the recommended options, not your doctor. So, the algorithm is directing what happens next, not your doctor. And here's a little side note. Back early in my career and when I had my own practice, I shared a building with a neurologist, and he and I would have lunch every every few months, give or take. And there was one time we had lunch, and he said, "Well, Nancy, probably in about a year, my job will be replaced by a computer." I'm like, "What do you mean?" He said, "It's all just algorithms." He said, any of the medications that I prescribe, any of the testing I prescribe, any of the referrals I make to other doctors, it can be decided by a computer. So I still see that neurologists are still in practice, but that just to give you an idea, this is what was happening in the early 90s is that conventional medicine was going from an art form where a medical doctor could determine on his own or her own what treatment the patient should have or what testing, and it was defaulting to this algorithm, which then was considered the standard of practice. So back to stealth health. So your doctor does not direct treatment, the algorithm does. And I don't care what symptoms you walk into your conventional medical doctor with. Once they create a diagnosis, they are treating the diagnosis. All right, so let's go back to this algorithm. From the top box, follow the arrow to the right. In that box, you'll see the words, now moderate or severe symptoms, VAS 3 through 10. The VAS is called the Visual Analog Scale, and this is how you communicate to your conventional medical provider, and we even do this in my office, on your pain that you're experiencing. So, really simply, it means how much do your symptoms distract you from your daily activities on anywhere from a scale of 0 to 10. If not at all, or you can ignore it, It's probably a 0, a 1, a 2, or a 3. If you are mildly or moderately distracted by the discomfort, but you can still do all your normal activities, that's a 4, 5, or 6. If there's one or more things in your regular day that you cannot do at all or in a normal fashion, that's a 7, 8, 9, or 10. 10 means you're unable to do much of your daily routine at all. So suppose you were the patient and said, "Hey doc, I can hardly concentrate or sleep because my sinus pain is so bad." Your VAS would likely be in the 5, 6, or 7 range. Because the box says VAS 3 to 10, follow the next arrow straight down. And this says culture, topical corticosteroids, long-term macrolide, nasal lavage. So this tells us a few things. First, your medical professional will proceed with swabbing the inside of your nose and sending it to the lab. So that's the culture. And they're looking for unusual bacteria. Second, a prescription is written for two things. First, topical corticosteroids, which is a steroid cream, and a long-term macrolide, which is antibiotics, which you will take for 3 months. Third, a recommendation is for you to use a nasal irrigation device, and this one's probably the best kind of advice for sinus issues. You may know from my YouTube channel, I've talked extensively about how I was able to eliminate my 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 sinus infections with a Sinu Pulse, which is pulse water that goes in my sinus, my lower sinus cavities, and flushes out gunk. Love it. It's beautiful, awesome. You can use it every day, multiple times a day if you need to. Anyway, we're going to go back to sharing. And so now I want you to follow the cascade of events the next hour, and you see we have a choice. So if let's take the path that goes downward and turns left. And so from the topical corticosteroid, the culture, blah, 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 we're going to take this arrow, and there's improvement. Lovely. If you're improved, now stay with me. Keep following the arrow further left, so that's over here. There will be a follow-up visit which will result in additional antibiotics, continued lavage, and then you're sent on your way. At no point in the algorithm is a question asked about why inflammation or infection exists. For instance, is there a food allergy? Is there lowered immune function? Is there nerve transmission going to the sinuses that is not working 100%? Is there exposure to mold? Also, there's no place for things you may have discovered that are helpful for your sinus problems. Things like supplements are not mentioned, like vitamin C, um, essential oils, chiropractic adjustments, but it's not there, nor are homeopathic remedies or lymphatic drainage massage part of the plan. Nothing of other than drugs and testing is included here. Now, let's suppose, on the other hand, if we come out of this topical corticosteroid box and go to the right, and after 3 months, you are not improved, you're the same. So then we're going to follow the arrow down, and that means for 3 months you've taken antibiotics, and much to the detriment of your gut health, you've used the nasal irrigation and you've rubbed the cream on your face. 90 days without improvement. I cannot believe they would wait 90 days for somebody not to improve on that. That is sad. That's sad. Now, the next arrow points down to CT, which stands for computerized tomography. That's a 3D image x-ray of your sinuses. So it's designed to find abnormalities in the bone or in the sinus cavity. And by the way, radiation wise, it's the equivalent of about 200 x-rays. So there's that right there. And this test looks for something out of the ordinary in the sinuses. And I just have to say, If you've had sinus issues for now, you had it chronically, so it was already there for 3 months. You've been on steroids and antibiotics now for 3 months, so your immune system is taking a turn for the worse from the antibiotics. And is there going to be something wrong with the inside of your sinuses with those very delicate tissues in there? Yeah, yeah. So more than likely, they're going to find polyps and they're going to find areas of infection that are sequestered because your body has lost the ability to fight it off because you're really dampening down your immune response and your body's ability to heal with those steroids and with those antibiotics. So can you see how the system just feeds itself by creating more and more disease? So before I turned off my algorithm, you may have seen that after that CT scan, that test of your sinuses, the next step is surgery. So what do they go in? They go in and they scrape away infection. They create trauma with these very delicate tissues. The polyps that probably have formed. Now think about this. The inside of our sinuses is super delicate skin. It's a mucous membrane. It's very, very delicate. Think about the inside of your mouth, how if you bite your cheek, uh, and if you bite it, oh my gosh, it hurts like crazy. It inflames. This is delicate tissue, even more delicate inside our sinuses. So if it is inflaming underneath that tissue starts to bulge out. And then the inflation might recede, the inflammation might come back. And the more it comes back, the more stretched out and irritated that tissue is, especially if you're not feeding your body the fats it needs. Maybe you're not eating good fats, or maybe you're on a statin drug. And so this bulging out over time gets worse and worse, especially if you have sinus infection and you're blowing your nose a lot. This is called a polyp. So in surgery, they go in and they snip off that polyp and create more damage. So your body has to repair that. And well, how does it repair it? It repairs it with inflammation again. Oh my gosh. When you start to think about this, you realize that is medical care just feeds itself. The conventional medical model of diagnosing, drugs treat a diagnosis, surgery and intervention treat the diagnosis, and creates more need for surgery, intervention, and drugs. It just feeds itself. That was all just a side point. This is just getting me going. So let me continue back. So I talk about surgery. So surgery is not what you intended when you started looking for help. That's what you probably wanted to avoid at all costs. And now that you've been traveling this road, the next stop is to make room in your busy schedule for the surgery date, recovery time, and pulling long sheets of blood and pus stained cotton out of your nose. Ugh. And does this really address the underlying weakness that caused the sinus issues in the first place? Will your sinuses now be perfect because you underwent the surgery? What are your thoughts? I'll let you answer, but I think you're gaining the savviness to know. Conventional medicine, almost no matter where you go, follows the same exact algorithms. A diagnosis leads to drugs, testing, and possible surgery. Other options are not in the picture literally. The reason? Quote, evidence-based medicine. Now, this is a term used to describe current patient care guidelines. It is concepts based on peer-reviewed published articles in medical literature combined with simple rules of science and common sense. Okay, and I have that. That is from the Free Dictionary. I have that sourced. The peer-reviewed published articles, which is called RCT, draw conclusions from the results of randomized clinical trials. And I know all these phrases are they kind of make my head hurt too, but stay with me. In holistic care like chiropractic, cranial sacral therapy, prolotherapy, RCTs are hard to come by. Now, in the book Stealth Health, I throw out all of these on occasion. I will use the opportunity to throw out different forms of holistic care, whether it be prolotherapy, many have not heard of that, cranial sacral therapy, and throughout the book, I'll throw out different holistic paths of healing. And I do this for a reason because these are things that I'm very aware of, and many of them I've used for myself, but most the average American has not. And this has led to my podcast, your Healthcare Arsenal podcast, which this is being recorded on right now, because these words and these professions, I want them to become known. I want people to know about these options because um, because there's a world of opportunity for health and healing out there, and very often we just don't know what it is. So these RCTs, randomized clinical trials, um, that is what is evidence-based medicine. Well, maybe not. I have heard that only 15% of medical procedures are actually RCT based. That's another story for another day. But in holistic care, like chiropractic, for instance, RCTs are hard to come by. And that's because in this style of research, the RCTs, there are specific requirements. For one, there needs to be a control group. And this is a segment of people in the study who get a sham procedure or fake medicine. In a drug trial, some people get a sugar pill instead of the real drug. In that way, the drug effect can be separated from the placebo effect. So now I go into like faults of drug trials later on in the book, but just to keep it simple, in a drug trial, you might have 500 people on this side that think they're getting a drug, but they're really getting a sugar pill, and 500 people on that side that are actually getting the medication. And in a drug trial, the only thing the drug company has to prove is that the people getting the drug do slightly better than the placebo group because the placebo effect is super profound. Like I give you a blue pill and tell you your headache is going to go away from it. For a lot of you, that might actually work, even though it was just a sugar pill. We really need to study the placebo effect. Anyway, so the drug trial only has to make their medication just a little bit better than the placebo. That's crazy, right? So let's see. The placebo effect, I go on, means that you feel better. Well, because nobody knows why. Maybe it's because somebody is paying attention to you, or it's the power of the mind believing you are being helped. The placebo effect can be dramatic and does deserve additional study. For the sake of research studies, RCTs, the treatment needs to be shown not to be vastly, but merely slightly more powerful than placebo. Try to imagine doing an RCT on the effectiveness of acupuncture with a control group. So you would have to think of a way to stick people with acupuncture needles in such a way as to not hit an acupuncture point. And that would be your control group. It could be done, but it's not easy. And it's the same for chiropractic. As soon as the chiropractor touches you, even to determine what spinal segment needs to be adjusted, the body responds. Whenever I just touch a patient, I am changing them. So in either instance, the response may not be ideal, but it's still a response. So it's different than having somebody just take a sugar pill. Holistic care models cannot be researched in the same way as drugs because a true control group is nearly impossible. Compared to medical applications, there is little data and few randomized clinical trials to support holistic methods. They do exist, but they are small in number and test the outcomes of a few people instead of thousands. But here's what's fun about this. Homeopathy has been around since before pharmaceuticals and since before the conventional medical model. Chiropractic has been around now for 120, nearly 30 years, 130 years. And in spite of the like the dramatic attacks at times on holistic care practices and professionals like chiropractic and homeopathy, they continue to shine and strengthen. Chiropractic is the number two health profession in the United States, if not the world. So, in spite of being attacked all these years, we continue to thrive. And you know why that is? Because people get better. That's why. The proof is in the pudding. So I go on. Masses of the population rely on their holistic care providers to help them make healing changes. Their testimonials, however, no matter how compelling, are considered clinical observations, not a randomized group, meaning that no matter how much you love your chiropractor, no matter how much he or she has helped you, it is not a randomized clinical controlled trial. That, coupled with other factors that favor the status quo, leads to little or no mention in the conventional medical care algorithm for alternatives. So I go on to throw in a few other terms and holistic healthcare pathways: hypertherm cocoons, tuning fork therapy, matrix repatterning, or whatever alternative method works for you does not find its way into the literature. So we're going to leave it with that for today with our Stealth Health secret intel. And we will continue to shake the legs of belief next time. So, as always, I am hoping that with each passing episode, you get better to being your own best expert. Bye for now.